My name is Danielle, and I have the privilege of serving as program coordinator here, and wanted to make sure that we've gotten a chance to connect. I know that this is a really special time to see all of your faces and to know that this community continues even when we're socially distant. So I want to thank you all for being here today. We do like to start out each event with a moment of prayer. And today is no different. I'd like to invite Pastor Rick Garrett from Grace Community to lead us in prayer. And Rick, will get you unmuted here and get you started.
I think I've got it, Danielle.
Perfect, thank you. I couldn't find you.
Yeah, no problem.
I was under ours and you weren't there. Thank you so much, Pastor.
Yeah, thank you guys so much for being here today. You know, one of the things our senior pastor says to us all the time is that the strong take care of the weak. And I think this is just such a beautiful picture of one of the ways our community comes together to take care of those who are weak and who need help, need assistance. And so appreciate your presence in our community, appreciate what each of you do to make the mission of IDignity possible. We are so grateful for Michael Dippy and all of the staff that serve and all of the volunteers that make this possible. So happy birthday, and let me pray for you guys. Father God, we are so grateful for your presence in our lives. We're grateful that you have called us to take care of the weak. And God, it's a beautiful picture of your gospel that you have taken care of us, and now you call us to serve others as well. And so God, I'm just so grateful for people in our community who are behind a mission and a vision of helping others, those who are finding themselves in a place that's just difficult, and that makes them seem nameless and makes them have no access to just some basic needs. And so God, we're so grateful for the work of IDignity, the work that they do to restore dignity to people who feel that they've lost it. And God, to do some of the really difficult, hard work of bringing churches and community organizations and government and so many organizations collaborating so that we can see people in our community served and helped and improved. And so God, I just pray that today's training would be one that is beneficial to the work that they do. I thank you, God, for each person that's on this call today, giving of their time, volunteering of themselves. And God, I know their hearts are also involved in this as well. This is not task work, this is heart work. And so God, we're just grateful for the love that they have for people, the love that they have for our community, and God, and the love that you have for us. We ask these things in your name. Amen.
Thank you so much, Pastor Rick. We're going to head on into just a few logistics, just to make sure we're all on the same page. You are all muted to prevent any background noise. If you do have a question throughout the orientation, feel free to type it in that chat box. You'll find chat by putting your mouse over your screen. A little bar will come up towards the bottom, and there's something that says chat in there. Feel free to do that, and we will have a time to ask questions as we get into this a little bit, and we'd love to go over them with you. I know that it's a weird time and we all have a lot of questions, and so we thank you for being a part of the planning, and thank you for your insights in that. Ben will be moderating this meeting, so he'll unmute you if you have any questions towards the end, and we'll make sure that you get a chance to talk as well. So while we don't have an event this month, we do know that there are many people and organizations that make these things happen and make this organization happen. And we want to continue to thank them because it's certainly not their decision to not be able to have events right now. So we do want to thank the Salvation Army for continuing to open their doors when we're ready to be able to start these again. Mears Transportation continues to be a big supporter of IDignity and would be there with the van and driver. So we do want to thank them. City of Orlando has always helped us with parking. And Orlando Health has stored our supplies and continues to store our supplies, even though we're not using them right now. So we do want to thank them for that space and for the delivery and pickup when we are able to have events. Our event sponsor today would be and is Orlando Health. So we do want to thank you, Orlando Health, and Carolyn McDowell, if you're here. She's from the community relations team at Orlando Health. So we do want to thank them for supporting IDignity and being a part of this mission with us. So thank you for being here. Lunch would have been 2J's, and we do want to thank them for their flexibility because we keep scooting it back a couple months, and they continue to say, hey, that's fine. We'll be there when you're ready. So we do want to thank them for their support. They've never done lunch before for us, so we do want to thank them. So today is this month is our 12th birthday. So we're 12 years old, and our 12th year is proving to be a little bit different, guys. It's proving the need to expand our creativity and our originality. But this isn't the first time we've had to be creative. Creativity, collaboration, originality, it's actually a part of our culture and our history. It's how we were started, and it's how we adjust this year. Liz Borth was able to join us today, and she was actually here when IDignity first started, as I know many of you were. But she'd love to share a little bit more about where we came from, how far we've come, and how far we'll go. So thanks so much, Liz.
Well, thank you, Danielle. I just want to speak back to when this began for me. All these many years ago, it's been more than 12, because we, the 12th event, or the 12th year of events is this year. But before that, I can remember a lady from, I believe, St. James, and Glenda Lanahan should know that, I believe, Ellen Smith. She came to Trinity, where I was working, and said, I understand that Compassion Corner is moving and they're going to be closed down for a while, and we're in a panic because there's going to be a lot of people that have needs that we just can't meet. And I'm assuming she said that other churches downtown will be in the same boat. So what do you have in mind? And she said, I just want to have the churches get together and come up with an idea. So there were quite a few people. Oh, there's 5 downtown churches, and those groups of people that had been contacted, we got together and just started talking. Now, we didn't know it, but at the same time, there was another group, and I think, Michael, you were in charge of or responsible for getting that group together, and they were talking about what to do for people that were indigent and homeless, and there's so many needs, and everybody was aware, or most people were aware at that time, that there was going to be restrictions on our identification through the federal government. So what can we do to help? And we also knew that without an ID, you can't get anything. So to help people that are down on their luck or having difficulties with jobs or houses or whatever, they needed an ID. So we started talking, and we probably talked a good 6 months. Plan. The 2 groups got together. There was a group, I think what it was called, something Focus. I forget what Focus stood for. It had to do with unification of churches. And they brought the 2 groups together, and we talked and talked and planned and researched. And on the May 28th, right? Because that's my daughter's birthday. We said we did it. We were at the Union Rescue Mission, and we did, or not, where were we? We were there, right? Yeah. Yep. And we got it all done, and here's the city and the county and the state, and they're all working together. And when it was all over, the volunteers sat in the room and looked at each other and go, what just happened? It was an amazing success. We don't know how it happened. I mean, I give credit to God, because this whole thing went very smoothly. And since then, it's just gotten better and more improved. And look at all the people. This is not all the people, but look at all the people here. One memory I do want to share that makes it worthwhile volunteering, ladies and gentlemen. I used to work in the provider room, which is the end of the line. I was the end of the line. And that's when people have been there since 3 or 4 o'clock in the morning. They're frustrated. It is now 10 o'clock, and they're saying, how come he gets to go first when I was here longer? So we had to explain the system of first come, first serve. And it still was very tense. People would be crabby, would speak loudly. They never at that time did I get any physical violence, but there was always very disgruntled people. And one particular time, a man was giving a lot of mouth. He was really being pushy and shovey. And I just kept talking about first come, first serve. This is how it works. You're not going to be forgotten. You're on the list. Your turn will come. And another man looked at him, another client, and said, dude, just cool it. Be quiet. They are doing the best they can. Be thankful we're not having to do it on our own. And he said to me, if I had to do this by myself, it would take me days and I still wouldn't be done. We thank you. I just thought that's a neat thing to hear when you're struggling, that there are still people that really do care and are very thankful that we've done what we do. So that's all I have to add. I'm sure that all of you had some memories pop out of that little speech. I hope you did. And I can just say that when I finally retire, which I have no idea when that will be, I will be back to volunteering full-time with IDignity. because I miss you.
Thank you so much, Liz. We miss you too, so much. So thank you for that. And I think hearing those stories of that first event, it just, we've gotten to a point where these events were, they're so streamlined, right? We have a system, but you guys didn't have a system back then, and you just had to figure things out and be creative and adapt. And it's really amazing, the legacy that was started in that May event, to 12 years later of still loving our community in this way. So thank you so much. There are a few, go ahead.
I didn't want to interrupt, but I have another story first. I just like to see if anybody remembers what this is. See that number on there?
Is that a cue card?
That is a cue card from the third event. That is my cue card from the third event. July 2008.
He was a client.
And I'd like to point out this wonderful thing. I don't remember that, but it said services desired. And one of the services there is Christian prayer. I never noticed that before, but I haven't looked at this in a long time. So,
hey, Brad, that's property of IDignity. I'm going to have to ask for that back.
See the 3? Does anybody know who JVN would be? That's the initials on my card.
Janice Nesbitt.
There you go.
Do you think it was? It probably was.
Probably is. She was probably the first. So I just thought I'd share that with you guys.
That's amazing. I love that. And Hap just asked how many clients were served that first event. The first one was 152, but then you can see the community finding out about it, because that was 198, 218, 230, it just 260. It just kept throughout that year, just kept multiplying because of the need, and people's lives, like Brad's, were affected. And that's pretty amazing seeing, I love seeing that cue card. Thank you for sharing that. I'm so glad you kept it too. That's amazing. All right. Well, thanks so much, Brad. And thank you, Liz. There are a few other people who wanted to wish us a happy birthday that weren't able to join us today. So we are going to hit play here a minute.
Happy 12th birthday, IDignity. I'm proud to support IDignity since the very beginning. Our community is better and a more compassionate place thanks to IDignity's staff and your many volunteers. Thank you all.
Hi everybody, how are you? This is Sandy. Hi! I hope you guys are enjoying this wonderful day. I'm just making a message just to wish all of you guys a happy birthday. I started working with IDignity through the Flowmobile, or the bus as we commonly call it. IDignity gives the people that first step to have hope, to move forward with their life, get themselves in a better place, regardless of what it may be. A friendly smile, an identification card or driver's license, obviously. But that's what you guys offer, and that's what I love about you guys, and that's why I love working with you guys. Hey, have a great day, and we will talk to you later. Bye.
Happy birthday, IDignity. Wow, 12 years old. That means you're almost ready for, well, middle school. Be careful about gym class. That's where the bullies are. In all seriousness, though, congratulations on doing so much to help so many. You guys are out in the trenches every single day, fighting for human rights and human dignity in a way that nobody else is. So thank you, congratulations, and here's to 12 more years.
Loved that video. Thank you so much, Ben, for putting that together. Thank you, Sandy, for also being a part of that. All right, we like to start out our orientations with going back to the beginning, right? And it's especially prudent today. So I like to go back to our mission and our values. Our mission is to restore dignity and hope by assisting individuals in regaining legal proof of their identity. And it was founded on these values: dignity, excellence, stewardship, empowerment, compassion, and justice. And we're over a month into social distancing, and I know we all miss each other and the interactions with those around us. We miss family, we miss friends, we miss our clients. So as we head on into this next phase of recovery, here's our challenge to you and to ourselves here. This month, we challenge you to find 12 opportunities to show kindness and love to those in your life. Just 12 acts of excellence or compassion or justice. Just because we're not at an IDignity event doesn't mean that this IDignity family can't impact the community. When you're done, we'd love to hear your stories. Share them on social media, share them with IDignity, and hear how you're continuing to impact those around you. Thank you for being a force in this community of good and of dignity and excellence. Just a couple announcements. Life is certainly different here. I never dreamed we'd be doing a second virtual orientation, honestly. But here we are, and here we might be for a little while here. We wanted to give you an update as to what's going on here. We're still doing our best to protect those around us. The staff is working as remotely as is possible, and we're doing our best to serve clients from a distance. We know that the way IDignity looks is probably going to have to change, not only now, but for the current and for the foreseeable future. We're encouraged, though, that this legacy that we heard about today that was started 12 years ago, it's a legacy of innovation and creativity. We know that that same drive to adapt will allow us to continue to serve in the safest way possible. Our plans for the foreseeable future, just so we're all talking about that and all aware. Currently, the way it's broken up, I like to think of it in three different ways. It's kind of a three-part plan, but the first is a virtual service method. So we're building the process of serving clients virtually, going from intake all the way to the start of OSBC. Through video chat programs like this or phone calls, and a whole ton of collaboration with case managers. We're hoping to at least start the process in a way that reduces the amount of contact between individuals. We're also looking at doing some smaller client care days. As many of you know, we've typically done the one big monthly event, and then every week that's not that event, we've done client care days once a week to serve clients in a smaller capacity. We're renovating that idea and looking at doing even smaller versions of those, working them out to do about 2 to 3 times a week so that we can reduce the amount of people interacting with each other, but still providing an opportunity to provide vouchers for IDs, to provide document distribution, to have them meet with the attorneys for difficult cases. So we're taking a really, really good look at PPEs, building in social distancing into the layout and the plans, and then coordinating the arrival of our clients so that our clients, our volunteers, and staff are all kept safe. And then eventually the third part of that is talking about doing those large events. We're going to continue to follow CDC guidelines regarding when it would be safe to start to serve clients in a large scale environment. We anticipate this is going to be a ways down the road. We're open up to about 10 people right now, and that's a far cry from letting 350 to 400 people enter those doors. And so we know this is going to be a while. But even then, when we aim to phase into these, we're going to be intentional about a proactive triage of clients before they get to the event to focus on those who need to meet with government agencies at the time. All the others who are not ready to meet with those government agencies will be redirected to those client care days or to virtual services. The idea is that they'll start out with a smaller number of clients being served, and then we can work our way into those larger events only when it's safe for everybody involved. So we wanted to give you guys that update to know that these are the things that are on our minds, that are in the works. We don't have a location quite yet solidified for those client care days. And once we do that, we'll hit the ground running with making sure that it's built to be safe, building in that plexiglass barrier, making sure that we have the cleaning supplies, and making sure that we're building it so that everybody involved is safe in that process. We will have time for a few questions about that in a little bit, but right now I do want to invite Ann Taylor up to the microphone.
Hello, everybody. Good morning. I want to say thank you for those of you that have sent in checks and notes and made online donations. We have been so touched by each and every donation that has come in. Thank you. Especially in this time of uncertainty, we are so very, very grateful for your financial support. That is what is keeping us up and running and keeping the staff employed. So we are extremely blessed by each and every one of you, and we know we can count on you to keep IDignity running strong in the months ahead, and that gives us a lot of security and just fills our hearts with gratitude. So thank you. I want you to watch your inbox for IDignity's emails that you can share with your family and friends. I'm really excited about the incredible work that Ben has been doing to really get the word out on our social media. I hope you're following us. And if you're not getting our newsletters, please let me know and we can set that up for you. In fact, you're going to be getting a newsletter today. So watch for that. If you all have any questions or just want to chat, I'm here. I'd love to talk to you. I'd love to hear from you. So continue to be blessed.
Thanks, Anne. And thank you all for being a part of this. Even in the midst of all this, I echo Anne in that gratitude to all of you that continue to support. We move into the fun part of orientation where we get to talk about our volunteer award. And we know that there are a lot of nurses and a lot of healthcare professionals that serve with us regularly, and we are so grateful for the sacrifices they're making. One of them we want to highlight today is Jeanette Arcara. She's a registered nurse. She's certified in serving on the front lines at Winnie Palmer with the mommies and babies for the last 31 years, and has also been a faithful IDignity volunteer and donor since 2012. She's been a champion for IDignity through the relationship with Orlando Health and in our community, and she shares our mission with her coworkers at ORMC whenever she can. So we do want to thank her for all that she's continuing to do in our community to love people in a really in a dangerous environment right now. So we want to honor her and thank you for joining us today, Danette.
Thank you very much, Danielle. Thank you. Hello, everybody. Golden ticket. Anne dropped it off at my house. Thank you so much, Anne. But I'm truly honored to receive this Golden Ticket Award. Thank you very much. And how poignant that it's coming during Nurse Week. This is Nurse Week. So that's really awesome. Just want to say, as a hospital emergency room RN, my focus is generally taking care of the patient's most immediate needs. We stabilize and send them onto their next level of care. And for most, that's an easy transition, right? But what happens if one doesn't have insurance? You get a hard stop, right? And then if one doesn't have an ID, it's even a harder stop. You can't get into Medicaid. I mean, it's just really difficult. And when this happens, it's truly heartbreaking. I've seen it time and time again. You can see the helplessness in patients' eyes. And it's at this point when I have the opportunity to tell them about IDignity, and then the hope comes back in their eyes, and that's a great feeling. I mean, it really is. So I appreciate that. So that being said, I think that IDignity is truly part of the healthcare system as a basic need frontliner, a hero organization, right? And so anyway, I want to thank you for opening my eyes to the need that you fill and for allowing me to be a part of what you do to serve those in need. So thank you. I'm going to put my mask on and I'm going to go to work. So have a good day, everybody.
Thanks so much, Jeanette. We so appreciate you. And she actually was able to take the morning off so she could join us today. So thank you, and thank you for your team too. We appreciate it.
All right, thank you. All right, bye.
Awesome, bye.
Bye.
All right, so we are heading on into a time to ask some questions and get some answers to some of your questions. I know that a lot of the stuff I threw at you a couple minutes ago is a lot, and so we're going to open up the table for you to ask questions. Michael will unmute you, and if you have a question, feel free to unmute yourself. Otherwise, throw it in the chat, and we will unmute you there.
Happy birthday, IDignity. So nice to see you all. I mean, it really does warm my heart just to look at all these different pictures and have all these different memories with all these different people, and just such special people you all are. Hearing the history about IDignity, and man, there's some crazy stories. And Brad, I just love seeing that cue card. Love seeing the prayer option. We used to have a separate room that pastors would sit in, that clients could go and be prayed with. Only problem is that I think we only had 2 clients in the 2 months we did it that took that option because they needed to get their ID and they could go to church next Sunday. But yeah, really neat to see the history of IDignity and all the adaptions that we have gone through, and how just established and professional and efficient and effective that we have become over 12 years. And now is another season of change and adaptation and adoption of certain new methods and practices of how we're going to deliver our services. But the heart doesn't change. You all are the heart. We need you to stay alongside of us, even if we can't have you volunteering right now at large assembly events. We need your encouragement. We need your support. We need to just see your faces once a month, if at all possible, on the screen and see you smile. And we all want to get back to the big, large assembly events, and we will get back there as soon as prudent, so as soon as it's safe for not only you all but also our clients. But in the meantime, we need to figure out how to continue to help people get their IDs, how to get them all their documents, how to handle their legal cases in a safe manner, because there's significant suffering that's happening right now because we can't get people their identification. So we got to take this initial step, as Danielle said, of how can we begin, or how can we begin serving clients face to face again, and how can we serve them more effectively virtually at the same time. So with that, see if got any questions from anyone, or just even any thoughts. Ben, how are we going to recognize who has a thought or question if everyone's on mute?
Yeah, everybody's going to be able to put it in chat or unmute themselves. Hap has the first question. So Hap, I'm going to unmute you, or unmute yourself there. There we go. You're unmuted.
Hey, Michael, I was just wondering if you all were ready for me to build the first prototype plexiglass barrier. I know that size is an issue, and I've got some ideas on that, but I just was curious where we are with that.
Yeah, no, it'd be great to have you involved in that process, Hap. We did meet with a construction company yesterday about just kind of brainstorming on physical structures and possibly even looking at the different sites that we're targeting, because some of it would require us to build walls and remove walls and some electrical work. And but we also talked about how would you design a table, and how would you design the plexiglass, and how can you communicate through the plexiglass? Is that a microphone and a speaker system? How do you do a pass-through through the plexiglass to get the documents to the clients to sign and back and forth? It would be great to have you as part of that conversation. We're not ready. We don't know where we're going to be yet, so we don't really know what the layout is of the physical structures, including the desk and the plexiglass. And I think within the next week or so, we'll probably be able to understand where we're going to be. And then we'll have a better guidance of, okay, these are the rooms that we're going to have access to. These are the size of the desks that we're going to need to build. And then, yeah, do a prototype of the plexiglass and see how hard it is to communicate through it. And do we need to get into some type of electrical audio intercom type of system for these interviews? And you know, this is we're building this as in it might be like this for a little while, but once again we're going to do everything we can to get back into the large assembly events and get back to what we did for the last 12 years.
I'm thinking of something kind of on a portable level that can be broken down after an event type situation.
Yeah, so the new model is a permanent location. We're looking at holding 3 events a week at a facility, and it could be like this for months, possibly even a year, possibly longer. And so the idea of breaking down and reassembling a site 3 times a week for the foreseeable future doesn't seem prudent. And so we're looking at a stable location where we can go, okay, we get these 3 rooms or 4 rooms, whatever they are. Because once again, it's not going to be a gymnasium. It's not going to be of that size. You know, we're looking at about 1,000 square feet, where we could have 20 clients throughout a day. And so we're looking at a more stable, permanent location. It doesn't have to be broken down and set up every single 3 times a week, because I just think the wear and tear on that and the time it takes to do that probably wouldn't be prudent. But everything's in flux, and we're going to try everything and look at all different. We were talking about setting up a circus tent just yesterday in the field that we bought, and having events there if we had to, and everything's on the table.
So I think that what we can do, Hap, is I would love to get you involved. I think you're definitely, your background is really helpful. I'm going to say that we take the details of this conversation offline, and make sure that the questions we continue going through are being able to ask. But thank you so much, Hap, and we'll definitely be in touch about details. Does that sound good?
Thank you.
Yeah.
All right, cool. The next question is from Kathy. Kathy, you are unmuted. Wait. Kathy, are you unmuted?
Yes, okay.
Okay, good.
So I just had a follow-up question. It feels like we've heard from Ann every month about funding and contributions, and I'm hearing some unexpected expenses coming up, or maybe they just are being redirected. I'm not sure. Just wondered a little bit about the impact of this on the budget that IDignity has established, and also maybe that would also be addressed with what are you finding, this is kind of a second part, what are you finding with being in connection with other agencies outside of Orlando? It's just like everybody's in chaos, right? Are you able to so that's a separate question, really. How are things going? Okay, on that note, bye. Okay.
Yeah, I mean, the first question, I appreciate y'all looking at that other side of IDignity, the financial side, and budgets are a two-sided coin themselves. They're how much are you bringing in and how much are you spending? And yes, there are certainly additional expenses that are coming on, just buying cleaning equipment and masks and hand sanitizer and paper towels. It's just there are expenses there. There'll be expense in leasing the space that will allow us to operate on this smaller side. But hopefully a lot of that will be donated, much like most of our space use is. And the build out, yeah, there's going to be some material costs, but the construction company that we're talking to is one of the bigger donors to IDignity, and I'm sure they're going to be doing a lot of in-kind materials and labor to help us build that. Some costs are down right now. Some of our expenses are down. When you don't hold events for 2 months, there's a lot of money that we're not spending that we typically would have spent, so there's savings there. The staff has taken a sacrifice as directed on a no increase in wages this year, and we're keeping an eye on it. But thankfully, IDignity is in a fairly strong financial position. We are fortunate that we've had 12 years of good financial support, and been able to squirrel away a little bit of money in our emergency savings account. And this is what emergency savings accounts are for. When you're in a pandemic, when you're in a global recession, that's when you tap into the emergency savings. And so we're looking at that as well. We are very fortunate that we were, at the time, one of 3% of organizations that were successful in applying for the payroll protection program. And so we were able to secure that. And so that was a good $80,000 to help pay the staff for 2 months. So yeah, so we'll continue to keep on looking at where we can cut costs, but at the same time, how can we creatively raise money when we can't have fundraisers of the traditional kind of Seeds of Hope, and the super might be on the risk this year as well. So thank you for that question. Didn't really follow the second one as well. Okay.
All right, Gail Lippincott had a question. Gail, I'm gonna find you here a minute. There you go.
Hi. It was a follow-on to HAPS, and then I realized you wanted to take that offline. But I was wondering, I was reading about the UV lights and that there are portable UV lights. One lady has one, she keeps it in her car, puts it on her steering wheel, I don't know how she uses it, if it goes into the battery or something. But I wondered if that would be a way to I think it's 20 seconds or something, zap the document, pass it through the plexiglass barrier, let the client sign it, zap it again. That might be something to think about.
Yeah, no, we'll be looking at, yeah, UV light, definitely, it's a great product. There is some safety risk when the light is actually exposed to where people can see it. But we'll look at everything. And if you have ideas, certainly reach out to me or Danielle, and we'll put it in the hopper. I mean, literally, we were talking about circus tents yesterday as a place for location. That's how far out we're going. And so everything's on the table, and I appreciate it, because there might be some stuff, and there probably is, that we haven't thought about.
You're muted. Danielle's muted.
I'm just talking to nobody here. The only thing that can hear me is my cat. Anybody else have any questions? I'm trying to catch up on chat here a minute.
Jim had a question.
Great, thank you.
Masks wipe the smiles off our faces. That for me is a major tool to build trust with the clients. What alternatives can we explore to build trust? I thought that was kind of a good point.
Yeah, no, you're absolutely right. We could draw little smiles on the mask. I don't know. It's at the end of the day, we got to figure out how to get people identification. I think you can see a lot of love through people's eyes as well. And you can see also love through the action and the temperament of the people that are sitting across from you. And hopefully someday we can get to the other side where we're not wearing masks and people can also see our smile. Or they come up with clear mask. There you go. That's our fundraiser. Someone come up with clear masks so you can see people smile.
And they actually do have some of them for like when people are hearing impaired too, because it's hard to, a lot of people read lips. And so I've seen some products out there for that, which is interesting. I have no idea what pricing is or anything like that.
And Curly will certainly put you in the hopper for helping us build out.
All right. Any other questions? Oh, Louise. You are unmuted, Louise.
Oh, okay, I can ask the question. I just wondered if you were going to need volunteers for the client care days.
Yeah, we certainly, I mean, yeah. Bottom line, it's not going to be 100 volunteers, at least not at a time. But yeah, everything IDignity does, we center it around the volunteers. Volunteers are the heart of the organization. We operated for the first year and a half as an all volunteer organization, and that's part of our DNA. And we're not gonna jeopardize that. So we are planning and how to build that into the system as well. And there's also going to be a more intensity about the volunteers needed in between those events. Communication is going to be probably 3 times as much of an effort to do these reservations, to do these appointments, to coordinate with case managers, even to coordinate with government agents, because they're not going to be there on site. So in between events, there's going to be an intense volunteer opportunity for coordination and communication. And then also some opportunities at these many ID clinics. So yes, there will be an opportunity, and hopefully all y'all will come and join it, and give your thoughts about what we can do better as well.
Thank you.
I want to say on that note, if anyone wants to reach out to me, please go ahead and send me an email so I know in which area you'd be interested in helping. Either client communications at the office, client care days, because we do have to grow that team as well, as we plan it.
And I almost forgot, and I'm glad I didn't, because I'd be remiss the rest of the day. But today, IDignity is celebrating Vielka, our resource coordinator's 2-year work anniversary. So I'd like everyone to, yay, 2 years. It's Good run. Ain't 12 years, but it's still a good run. What else, Danielle?
I don't see any other questions in there, Ben, unless you do. Anybody else have any other questions?
Thank you, everybody.
I think
God
we will
bless
wrap
you.
up
Love
here.
you.
Yeah.
Happy anniversary.
Absolutely. We're going to go ahead and wrap up. We'll end with a quote because we always do. This one is by Winston Churchill. The pessimist sees difficulty in every opportunity. The optimist sees opportunity in every difficulty. And so in this time of difficulty, there are a lot of opportunities to love and to care and to serve. So thank you for being on this journey with us. May God bless your compassionate generosity. Stay home and have a great day.
Miss y'all.
Bye.
Bye.
Oh, miss you.
Bye.
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 Thank you.
Thank you.
Bye, everyone. Miss you much.